Are psychedelics good for mental health and substance use problems? This is a complex question, and the answer depends on what we know from current research, what we don't yet know, and the risks involved. Let's break down the evidence. Psychedelics are substances that can dramatically change the way people perceive and experience the world. They can create vivid sights and sounds, alter moods, and promote a sense of connection with nature and others. These substances have been used for thousands of years by cultures around the world, often for religious or spiritual reasons. Today, there's renewed interest in their potential to help with mental health and substance use problems. Recent research suggests that some psychedelics may be helpful in treating mental health conditions such as depression, anxiety, and post-traumatic stress disorder. These substances have shown potential for their ability to help people process emotions and break out of negative thought patterns. For example, studies have shown that certain psychedelics can increase connections between different parts of the brain, which may lead to greater creativity and insights. There is also interest in whether psychedelics can help with substance use problems, such as addiction. Some early studies show promise in this area. Psychedelics that have been shown to possibly help with substance use disorders are psilocybin, which is the active compound in magic mushrooms, MDMA, which is also known as ecstasy or Molly, LSD or acid, 5-MeO-DMT, which is found in the secretion of a toad, and DMT, which is produced by our own body, but also sold usually in crystal form. Ayahuasca, peyote, and ibogaine have also shown to be potential substance use treatments, although they have been less studied. It's important to recognize that much of the research is ongoing, and we don't yet fully understand how to use psychedelics safely or what their long-term effects are. In many cases, the popularity about psychedelics goes beyond what the scientific evidence actually supports. While psychedelics are not considered addictive, they can have powerful effects on perception and mood. This can sometimes lead people into dangerous situations or cause psychological distress. It's also important to consider that psychedelics are mostly illegal substances, except in certain states. Oregon has legalized the supervised adult use of psilocybin in licensed service centers, although this is not classified as medical treatment or therapy. Colorado legalized the use and possession of psilocybin and several other natural psychedelics for adults, and plans to open licensed facilities for supervised use. Several cities, including Denver, Colorado, and Oakland, California, and others, have decriminalized the possession of small amounts of psilocybin and other natural psychedelics. If you or someone you know is interested in psychedelics for mental health or substance use problems, the best course of action is to seek guidance from qualified healthcare providers. It's essential to weigh both the potential benefits and the risks, and not to overlook the complexities involved in this evolving field. For more information, please visit our Psychedelics Resource Center.